Hey there. So I'm a fanatical reader and a researcher. I like my evidence to be hard and specific. But there's also a side of me who likes to see the big picture. So over the years, I've cultivated a good understanding of exactly who I am, what I've overcome, and what I've learned. And really, this blog and everything that I do is an expression of the vision of what I'd like to see more of. You see, early in my life as a lupus patient, I've had to learn how to manage my disease in a way where I felt comfortable that it was under my control. But time and time again, through scary threats to my health, lupus has reminded me just how fragile my life was. I was reminded of how in a moment's notice, everything in my life can come to a screeching halt. Left with nothing but fear and anxiety, I've had to rebuild my health and confidence time and time again. It wasn't easy, but through the process, I've learned a few things. Let's talk a little bit about truth versus facts. So according to dictionary.com, a fact is defined as something that actually exists. It's reality. It's the truth. Your fears have no basis. In fact, it's backed by evidence and science. On the other hand, truth is considered to be subjective to interpretation and more three-dimensional. It involves responsibly and honestly assessing with integrity the experience and facts to find the truth of the matter, so to speak. It's an ideal or fundamental reality transcending perceived experience. So, reality versus theory. I've been fortunate enough to be exposed to the highest caliber of professionals, educators, and the likes. And as a patient, though, I've always found a lack in the connection between what is factual in theory and what is the ultimate reality and truth. All scientific bases and evidence didn't serve me very well. The treatments used in my care for lupus specifically were for sure helpful to treat my disease because I've always questioned my doctors. Many had to gather evidence and science from PubMeds and research to prove to me that research proves what they are doing is the best treatment approach. I wanted to know. And at the time, I didn't really have a choice to refute or deliberate on the proper treatments. It just felt better reading why and what was being done and then knowing the prognoses for what's to happen to me after the treatment. It was really scary when presented with your own predicament and the only choice for treatment seems so far off from where you ultimately wanted to get to. And the perceived side effects are minimized in favor of the risk versus benefits. So let's talk a little bit about facts. Here's my thoughts. Doctors are biased to treat disease. What they see is disease and must base their judgments on the facts. Facts are relative to the individual and often there's inherent bias in the facts alone. Health is then ours to protect and create. At some point in our journey with our disease or symptoms, you're at the mercy of the medical doctor who is quick to pull out the prescription pads for whatever symptom you may have. Their main objective is that and only that. That's what they're trained to do. And if they are forced to listen to our rants, they can be patient, but at times not so much. They've got other sick patients to quiet down and place prescriptions on. I hear many patients that complain about their doctor's approach to their care. But remember, that's what they're trained to do, period. That's the medical system in a nutshell. So let's talk a little bit about truth. When diseased or sick, you're ultimately on your own. I've had great doctors and then I've had some not so great. There are limits though to what they can do for you. Good ones at least pretend to listen and advise, but only within the standard of medical restrictions. They have far too many patients to worry about, and the nuances of how your symptoms affect you is not really an issue for them. The reality of what you wake up with every day, the anger, the fear, the resentment, and the anxiety are all something you're left to reconcile on your own, isn't it? And as for creating health, no one understands or knows what you wake up to every day. So whether it be so much pain, fatigue, anxiety, severe brain fog, or difficulty walking, or a rash, the deformity that symptoms of inflammation or disease can cause and their effects on you emotionally, physically, and socially is not something we have help for. So I'm here to tell you, you're not alone. But the first step to getting well and creating health from disease is recognizing this big picture and understanding the limits and the role of your collective medical team. Functional medicine, holistic medicine, or integrative medicine, call it what you will, is a means to an end. Truth is that no one understands where you've been. The more you understand and clearly define what you want, the better result you'll have with such practitioners. Because at the end of the day, it's your life, it's your health, and it's what you've got to commit to. So the truth is to ask yourself, what exactly does health mean to you? For me, it means so much that it's my first priority, it's my life, and it's worth fighting for. So most importantly, nobody else can fight this battle for me. So I want to make sure that I'm clear on the strategy. Do you need help? Please schedule a discovery call with me. I'd be happy to talk to you about this. Thank you so much for listening. And as always, please subscribe to our YouTube channel, our podcast on iTunes, Health Made Easy, and like and follow us on our Facebook, Alkaline Wellness and Lupus Rebel page. And my Twitter handle is @Dr. Connie Jian. See you next week.